The mini balloon button is indicated for long-term enteral feeding and/or stomach decompression. The mini balloon button is available from French size 12 to 24. You're now going to see nutrition nurse Jill placing a mini balloon button on little Solomon. First, prepare the procedure by arranging the equipment needed: an AMT measuring device, empty syringe, lubrication jelly, and water for injection. Changing a button is done as a clean procedure. Measuring for a new mini balloon button does not have to be done at every button change, but should be checked regularly to ensure a good fit of the balloon button. To use the AMT measuring device, a loose slip syringe filled with 5 ml of air is needed. Prior to placing the measuring device, the balloon integrity should be checked by inflating the balloon with the air. If the balloon functions correctly, deflate it and add lubrication on the tip of the measuring device to ease insertion. It may be useful to place a towel to the gastrostomy side, as gastric content may leak out when changing the balloon. Use an empty syringe to remove the water from the existing button. Apply light pressure to either side of the external aspect of the button while gently easing the button out of the tract. Insert the measuring device until the balloon lies inside the stomach. This will depend on the patient's size. In children, 3 to 4 centimeters is usually sufficient. Inflate the balloon with the 5 milliliters of air. Pull the measuring device gently up until the balloon lies against the stomach wall. If possible, take a measurement lying down and sitting up to ensure the correct fit for all activities. Slide the blue disc down to skin level. Use a size in between the two readings. Keep the measuring device in the stoma while preparing the mini button for insertion. Before opening the new mini balloon button, check the size and expiry date. Sticky labels are on the box for the patient's notes. The mini button fill volume is written on the end of the inflation port. For example, a 14 FR button is filled with 4 milliliters of water, while a 12 FR will be filled with 2.5 milliliters. Prior to placing the button, the integrity of the balloon has to be checked using the lure slip syringe included in the pack. Fill the balloon with the volume of sterile water as recommended on the inflation port. Remove the water again from the balloon once checked. It might be useful to use an AMT introducer to place the mini balloon button, as it can make insertion easier if the patient has a tight, deviating or particularly long stoma tract. The introducer comes in 2 parts, a clamp and a soft blue plastic stiffening stylet. Insert the rounded tip of the clamp into the mini balloon feeding port. Insert the stiffener through the clamp until it reaches to the end of the mini button shaft. Lock the stiffener in place by squeezing the clamp shut. Lubricate the tip of the button to ease insertion. Withdraw the air from the measuring device and gently remove it. Mini button placement without an AMT introducer. Again, placement with an AMT introducer. Introduce the mini balloon button into the tract. If the tract is very tight, a corkscrew movement is advisable. When the mini button is fully inserted, unclamp the AMT introducer clamp and remove the stylet. To avoid damage to the mini button internal valve, always remove the stylet before removing the clamp. Gently remove the introducer clamp while holding the mini button's external bolster against the patient to prevent the mini button from falling out. Inflate the balloon with the recommended amount of sterile water. Twist the syringe lightly while keeping pressure on the plunger and remove. Before attaching the mini button extension, set close the clamp to prevent gastric content from leaking out. To attach the extension set, make sure the black mark on the button is lined up with the black mark on the extension set. Hold the button on either side and push the extension set down until fully inserted. Lock the extension set by rotating it 3/4 until resistance is felt. The correct placement of the new button should be confirmed to check it's definitely in the stomach. This is done by doing a pH test. Attach a purple enteral syringe to the end of the extension set. Open the clamp on the extension set and aspirate stomach content. Add the content of the syringe into a pH strip such as enteral pH 2 to 9 and check the reading on a colour chart. pH reading from 1 to 5.5 indicates correct placement. To keep the extension set secure and stop it from pulling on the button while feeding or winding, it's useful to tape it onto the patient. If taped to the back, it's out of the child's vision, making feeding and winding easier. For winding, use a 60 ml syringe without a plunger. Open the clamp. When the wind and gastric juice has bubbled into the syringe, close the extension set clamp again and insert the plunger before removing the syringe to avoid stomach juices from spilling. Flush the mini button and extension set after position confirmation on a new placement, after feeding, winding, and each time medication is given. Using a stop-start mechanism helps to get a more effective flush. Close the clamp and remove the syringe. Always detach the extension set when the patient is not feeding, as the weight of the extension set can cause irritation if left attached continuously. Clean the extension set with hot soapy water and let it dry in between usage. The gastrostomy site needs to be cleaned every day. First, check the site for redness, leakage, or for any signs of pus. Use gauze with water to clean around the button. Repeat until the side is clean. While cleaning, rotate the button in a full circle. This prevents the balloon inside the stomach sticking to the skin. Finally, dry the skin around the button again.